If you were walking by a nursery and you're looking at a bunch of babies, what would make you feel that you are comfortable these are probably perfectly healthy newborns?
Well, the first thing that you do is when you see a newborn, you observe the newborn. And you watch the baby for various factors. You look at the baby's color, you look at the baby's level of activity, the baby's state of alertness, if the baby is breathing properly, and the position the baby is lying in. And after that you observe the baby, obviously then you may want to examine the baby and get more detailed information about the baby's condition.
Well, many of them are sometimes a little cold, a little bit of blue, but that doesn't mean there's a problem, is it?
When we're talking about a blue baby, or what we call in medical lingo cyanotic baby, that's an ominous condition. Most babies after delivery may be a little cold due to their adjustment to the environment, they're losing body temperature, they're evaporating amniotic fluid that they come from, and they may be having some adaptation to the extrauterine environment, circulatory adaptation. They have to absorb lung fluid that's filling up their lungs while they're developing in the womb. So there are a lot of color changes that they undergo. They undergo in the first couple of hours, they go through what we call a transitional period in which they actually adapt to the extrauterine environment from the intrauterine environment, which requires a lot of changes in their circulation, in their respiratory status, level of activity, and so on. So we do see changes in their color, changes in their respiration, in a lot of the autonomous nervous system functions and the motor functions of adapting to the extrauterine life.
When you look at the baby also, you're watching the arms move symmetrical. There's no jumpiness or jitteriness to the baby. Sometimes you see a little bit of extra movement in the muscles sometimes.
Babies do have a certain reflexes that they are born with, what we call primitive reflexes. And those reflexes will be triggered by all kinds of stimuli. So they may have all kinds of abnormal, or what may be regarded for an older child or an older infant as abnormal movements, when they are actually maybe normal as reflexive movements. They do have, for instance, a startle reflex, what we call a Moro reflex. If you shake the baby suddenly, or a sudden loud noise, the baby will start flailing his arms and hands and feet, and present with a scared-like kind of emotion. That's called a startle reflex. If a baby's head gets turned, they have what we call a tonic neck reflex, such as similar to a fencing position. And when you change the neck position, they will change direction of the arms and the legs going in the opposite directions. So there are a lot of reflexes and movements that babies have that are actually normal for a newborn, which may be construed as abnormal if somebody is not aware of what they really mean. So there's no real reason to get scared unless the baby has a sudden jerky movements of the total body, such as what we call global jerky movements, which may be an indication of a seizure disorder of some sort, and so on. But babies in the initial period of life, especially during the transitional period, adaptation period, will have all kinds of little jerky movements, little muscle jerks, and so on, as part of their adaptation, almost like as if the guidance system is trying to check all systems to make sure that everything is ready for a go and a takeoff.